A new system of coronavirus restrictions for England is due to be announced in Parliament tomorrow, with considerable debate within government and questions from those likely to be affected about how it will work. It will involve 3 levels of restrictions depending on the danger posed by the virus in a particular area. We'll be exploring the political decision-making in a moment, but first to Liverpool, where significant new curbs are likely. Our correspondent Dan Johnson is there. Dan.
Yes, case numbers have been rising here and across other big cities in the north and into the Midlands too. So there's acceptance that further measures are needed and that will be likely to result in further economic pain. But this is not just about health versus wealth. This is about culture, enjoyment, about the amount of life we can actually continue living. And on the table are pubs, clubs, the gyms, bookmakers and casinos here. And the region's mayor told me tonight that he will not agree to those closures until there is the right support in place to look after the workers who will be affected, and until he has a clear way out of these local lockdowns so that cities like this are not stuck in another lockdown for month after month. On the loudest, liveliest streets, people worry about what's to come, and they want to be listened to be understood.
All the things that are getting cancelled, the things that they enjoyed this time of year, Halloween, bonfire night, Christmas, so these are the things that we're going to have to compromise with. If he'd have done it earlier, I think we could have got this far.
The only way you're going to do it is total lockdown. Once you've got total lockdown, you've got it under control.
We were doing really well before all of this happened.
But listen to Connor, running a pub already quietened by local restrictions.
We're not even breaking even at the minute, never mind being able to pull back all the rent that we still owe or pay back the wages that we topped up. And further restrictions could be a final nail in a lot of people's coffins, unfortunately.
And I would say our sales are down 50%.
And Jonathan's wondering whether restaurants will be hit by new tiers of rules.
You know, Liverpool has known tough years, and I've been here when it's been tough, but you know, of the last sort of 10 or 15 years, it's been a brilliant place to be, and it worries me that rug could be pulled.
Consider too the challenge of enforcing even tougher restrictions. This was Liverpool city centre last night. There's frustration about how these rules are being introduced, and there's concern about how and when they're lifted.
Make no mistake that these measures are probably equivalent to what happened back in March, and we thought that we'd turn that corner, didn't we? But our infection rates are still very high.
Do you think you'll be able to reach an agreement tomorrow?
I'm hoping that we can get there. It appears that the government, in good faith, entered into these talks. It's a real pity then to find that some of the detail of them was leaked before we had a chance to sign things off.
It wasn't just Liverpool busy at 10 o'clock. Look at London's Leicester Square. And in Peckham, they were playing cricket. The government denies it's unfairly targeting northern cities.
And there is nothing that we would ever do that penalises one part of the country over another. The Chancellor represents North Yorkshire. I represent North Nottinghamshire. Neither of us would want to do anything that hurts the North or the Midlands more than any part of the country. But it is right that we take a localised approach.
But after the curfew, came in, it was just game over.
But think about Joe, still paying for the taxi that no longer covers his bills.
You don't know where you're going to be in 4 weeks' time. Am I going to be driving a taxi, or going to be working in a factory, or living on the dole with no money?
Closing time is coming for more businesses. And this city, famous for the musical sounds it sent around the world, now waits with others to find out how much of life is about to be silenced. Dan Johnson, BBC News, Liverpool.
And our political correspondent Chris Mason is here in the studio. This announcement tomorrow is going to be for England. Chris, how much detail do you think we're going to get?
Well, tomorrow will mark the start of a distinct new phase in how the pandemic is managed in England. As we've been reporting, we will get the details of these 3 tiers
the different regions of the country will be placed within after weeks of debate in private. Don't expect it to be like, though, Jeremy Vine on election night, dancing around on the map and different colours popping up for every region immediately. It will take time, but we should get a sense of it relatively quickly. Liverpool, as we've been reporting, will be in that highest alert level, but the debate is still continuing. It's not certain it will be signed off and announced by tomorrow. And the talking continues in other regions too, between other regions and Whitehall. So leaders in the northeast of England, for instance, have a call booked in first thing tomorrow morning. There's been intense debate and discussions around the thresholds between these different tiers and the practicalities of potentially some places being asked to close, others staying open. I've been speaking to mayors and others today, and they have a blizzard of questions. They talk about the fraught and sometimes frosty discussions. So, for instance, could pubs in some areas close, but restaurants stay open? One mayor was saying to me, yes, but could a pub claim to be a restaurant and then sell a bag of chips and 6 pints of lager? So there's real practicalities here that have to be worked through. And what about the support for regions too in the second and the highest tier? Writing in the Telegraph tomorrow, Dan Jarvis, who's the mayor of the Sheffield City region, asks exactly that question. So tomorrow will provide some answers, but not all of them.
Chris Mason, thank you very much. Well, from that, let's bring you up to date on the latest government figures, which show that there were 12,872 new coronavirus infections recorded in the latest 24-hour period. That means the average number of new cases reported per day in the last week was 14,391. 65 deaths were reported. That's people who died within 28 days of a positive COVID-19 test, which means on average 68 deaths per day in the past week. And the total number of deaths across the UK is now 42,825. Well, within that overall picture, there are significant differences in the prevalence of the virus and what hospitals are seeing, depending on where in the UK you are. Our medical editor, Fergus Walsh, has been looking through the latest data.
There's a huge variation in coronavirus levels across the UK. This heat map shows the areas in red with the highest levels and those in light blue with the lowest. And just look at the range. Derry City and Strabane has 684 cases of coronavirus per 100,000 population. Glasgow has 243. Liverpool, 600. Manchester has 525 coronavirus cases per 100,000 population. Nottingham, 761. Merthyr Tydfil, 214. But North Norfolk has just 25 cases per 100,000 and Torridge in North Devon only 18. What matters is the impact this is having on the NHS. In northwest England, the worst affected region, there's been a big increase in COVID admissions in the past month, now averaging at around 150 patients per day, up by 60% in just a week. But that's still below the peak in early April, when more than 400 patients a day were being admitted to hospitals in northwest England with COVID-19. The key question is how bad this will get. Well, there are now more COVID patients in hospital in England as there were back on the day in March that the national lockdown was imposed. Now, things then quickly got out of hand and rose from 3,000 patients to 17,000 patients in England in just 3 weeks. Cases were doubling roughly every 3 days. That's happening much slower now, the outbreak doubling in size perhaps every 7 to 14 days in England, but it varies considerably across the UK. Now, back in March, there was no testing being done in the community. Now, many cases are being picked up much earlier. The worrying thing now is that winter isn't here yet, the peak time for respiratory viruses, things like flu. The NHS coped during the first wave by cancelling non-urgent surgery and cancer screening. The aim this time is to continue with non-COVID care, but that is dependent on how well coronavirus is kept in check for the next 6 months. Fergus Walsh, BBC News.